So, welcome, Daktari, and make a case for us today.
Welcome, Daktari. This is yet another episode. So today we are going to cover the case for computational health science in Kenya, mostly, but we are going to start generally, and then go to the specifics. My name is Dr. Osebe Clinton. With me is
Dr. Andrai David. I think it's been long, Doc. It's been 2 weeks. It's been 2 weeks since we met. So happy to meet again. And obviously with an exciting case on computational health sciences. You mentioned in Kenya, and I was like, okay, it's interesting. Let's see how that goes. I was seeing that actually with this paper here, I think that this paper is from 2018. Okay, then it's not that far long. Around. So it's interesting to see how this approach can be applicable for our setting or in our setting. So yeah, should be an exciting talk.
Okay, so generally we are going to argue health science and comp science should merge at this juncture. We need to there's been a lot of borrowing from both fields, and you as a student of computational neuroscience, I mean, you can attest to even some of your classmates not being strictly from the background of health or medicine, and they are tackling computational neuroscience. So I mean, I'm sorry, but today you're going to be our specimen a lot.
Actually, we don't do computational neuroscience. We just do neuroscience in general. However, I do agree with the computational bit because one thing when I started looking into computational neuroscience, for example, in itself, I always wondered what is in this computational that makes it computational neuroscience. And that is some whole other thing, and which we'll also cover as we go along. But just to maybe to form some grounding, even just from this paper, I've just seen that the authors were two authors. The first one was from public health, and the other one was from Department of Computer Science. So when you mentioned computer science and health science, I was like, you actually have to get two people one from public health and one from computer science field. And the interesting thing here is that people can actually have both. So you can have both the public health knowledge and both the computer science knowledge. And that's where the exciting bits come along. Mm-hmm.
Yeah, for sure. So computational science, do you want to help us define what that is in few words? Now that in many words we have been able to look at an example, and maybe in short words, can you say what it is?
I'll say in long, but anyway, from just the paper, I'm seeing that the whole idea of computational science is you trying to merge the computational tool. So think about the bits of computer science in terms of just data, computational stuff, not the hardware or that kind of stuff, more the skills and the workflow of how you do stuff in computer science. And then now you're trying to take that discipline and then you merge it into another science domain. So by doing that, you get that computational science, whatever that science is. For example, if it's neuroscience, then you get that. For example, now if it is in public health that you're seeing here, you get that health science bit. So in this bit, you're sort of defining two things. Number one, the computational bit comes with the idea of the fundamentals of computer science, understanding how computer science flows, the skills, the tools. And then this other bit is now the domain. Yeah, the domain is the word, the domain. So the domain can be public health, can be neuroscience. Then you get that computational science kind of field going on.
Nice. Thank you. So in a nutshell, you're bringing analytical expertise or insights or strengths of let me say now, the analytical bit which computers are very good at, and the domain knowledge which the human beings are really good at. Yeah, you have the domain knowledge, you have the expertise. You're a medical officer, you're a pharmacist, you're a nurse, you're a clinical officer. You understand greatly about your field than computers have been taught. But now computers are really good with numbers. They're really good with identifying patterns more than even human beings. We if we merge the two sciences together, we can be able to reap heavily or benefit immensely. Now you have talked about the computational bit, and it's like, okay, we know about the health science bit. So why do this synergy in the first place? Why bring these two fields together? What are some of the opportunities we are looking at, right? Now that we have defined what computational health science is, why would we do that in the first place? What are we trying to gain? What are we trying to benefit or reap off from this synergism of these two great fields?
I think in terms of benefiting, it all comes, okay, for just thinking out from the top of my head, when you want to solve problems and you're looking for different ways to approach the problem, combining this field might be a way to go about it. So also, if you want to have environments where you have multidisciplinary teams, combining these two fields might be also a way to go about it. Also, thirdly, in terms of just basic innovation. So if you want even to make something new that is not there, then you have to combine again these two fields. So those are the three things, either coming from a problem or a point of there's a problem, you need a solution, working in multidisciplinary teams, or even just innovating for much better experiences in other ways. So that's like the basic reason why these two fields should merge even in the first place. Oh, something else, even in design and inspiration, maybe just inspired. I remember there's this book. Can I remember the book? Can I remember the book? I'll look at the book and then I'll let you know. But there's this book that
Maybe you can capture the gist of what the book was about.
Yeah, now I'm trying. It was about algorithms and design. So how nature inspires design in algorithms. So it was the whole idea. For example, the way is it the hummingbird, the way they fly, and how aeroplanes, for example, can borrow that design to make them fast and something like that. Yeah. So you can see in that sense, we are borrowing from another field, and then you are using it in another field for sort of inspiration and that kind of stuff.
And I'd like to highlight an example. You see, studies like randomized clinical trials, they are really great for testing efficacy, but under controlled conditions, right? So we have questions which arise concerning real world effectiveness, safety in clinical, in actual populations, the side effects, and who an intervention works best for, even after you are done with your studies. And this is best answered by things like consistent records, which are kept in electronic medical records or electronic health record systems, right? So you have already done your trial and you have proceeded. Okay, maybe the study period has ended, funding is cut and stuff like that. You need to track these interventions that you tested or these interventions that you introduced. The only way to track that better is by having these records. And these records are kept in computers nowadays. So how do you decipher more patterns? How do you go away maybe from traditional health data sources and try to track it in real time? Traditional health data sources include the EHRs that I'm talking about. Now we have wearables, we have all sorts of IoTs. There's a way our good Dr. Masibo called them. I'm forgetting that word. But IoT is in the medical world. So the computational bits comes in here. You can get to have real world and real time insights from data that is being generated every second, right? Then we have also the social network analysis and agent-based modeling. These are just some of the opportunities I'm shooting off my head that we get when we merge these two fields together. So do you wanna maybe talk?
Yeah, even before that, what you're talking about is data mining. So at the back of my mind, I'm saying, okay, then how is this different from data science? So one might say, oh, Doc, okay, how is data science different from what you're presenting at computational science? Because from what you've just mentioned, the whole electronic records, going over them, and also to some extent, the social network analysis, to some extent, it sounds like data science. It's a tricky one, I might agree, but one area I might say, or where I'm seeing the difference, is that for computational science, even leave around the health science bit, is when you are thinking about designing these algorithms that now are meant to make that data mining process happen. So data science, on the other hand, now is that practice of now doing that data mining. So as you've said, there are health records here. We need to, for example, go over them. We need to arrange them in this section. We need to wrangle. So that is data science. It's more of a practice. For computational, it's now, okay, how do we even go about it? And this is now my my computational memory is coming into gear. The first time I really went deep into computational, it's called computational thinking, was some certain lecture I attended from YouTube University. So I attended YouTube University. There's these lectures from Stanford, and this series of lectures was called Introduction to Computational Thinking for Data Scientists. So I was like, okay, what is happening here? But the whole idea here was trying to introduce you to how you think about algorithms, how you develop those algorithms, so that at the end of the day, these data scientists will use these techniques to try and do this analysis. Now, back to your question, now how can this, for example, even be applicable, for example, in social networks? So you'll find that social networks exists. Data scientists will come to analyze these networks. But before they come and analyze, they need to figure out, okay, are we using breadth depth search, for example? Are we using which other algorithm is there? Can I remember? Whatever algorithm is there, which one are we using? So for them to have those options, someone with the computational know-how needs to have developed them for them to use, something like that. Mm-hmm.
Oh, you have talked about a very interesting idea of, in not so many words, topic detection and modeling. Actually, we wrote a paper on this. Oh, I was expecting you to quote that paper. And you even went ahead and scooped something with that abstract. So that will be a very good example of network analysis in the detection of adverse drug effects. Right? Yes, it was based on the Pharmacy and Poisons Board data.
Yes, sorry. So now that is data mining, but the algorithm that informs it is from computational. Oh, now I remember. Okay, yeah.
Do you remember those algorithms?
Yeah, it was, we did the LDA, latent
Dirichlet association, or something like that, yeah?
Yeah.
So now that is computational thinking, in the sense that you are thinking, okay, I'll give an example. We have a lot of drug effects being reported and some being missed. How are they missed? Because you have this Twitter user at ABC123 going to Twitter and saying, hey, you guys, have you been using this drug? Have you been getting this? Amani Mimi too. And then, you see, that is a missed. That's a missed reported side effect. But if you go and mine your data from Twitter maybe, and the geolocation algorithms are based on the content and context of your study, which is now maybe in Kenya, in Nairobi, if it's regional or stuff like that. You mine that data and you can capture all these complaints that are being talked about. Now, that is one thing that we call what? Post-market analysis when it comes to pharmacovigilance. The drug is already in the market, but you want to get the sorry, adverse effects being reported on. Because nobody will be able to go to the board and knock on their door and say, hey, I bought this drug at chemist A, B, C, D, at pharmacy A, B, C, D, but I'm getting this kind of reaction. They can't be able to do that. Most patients will go home and just experience those side effects, maybe call a doctor or two, maybe visit their doctor or not. And then that will never get to the board. Because we have a challenging reporting system where we rely on the goodwill of pharmacists in their workstations, be it in public or private, to report to the board about these side effects. And these pharmacists rely on the goodwill of patients to come back and report. But sometimes a patient, all they can do is just complain online. So how do you capture that? I think that's part of the computational thinking, the principles that inform computational thinking. How do you address these medical problems using computers, using these algorithms, using, in a way. So,
so what I'm picking is that now that we are bringing in the bit of computational and health sciences, is that in this case you're using, for example, drug effects reporting. The whole idea here is that not every report might be captured by pharmacists, either because of goodwill or systemic issues, maybe, for example. But at the end of the day, patients are making reports or complaining, and this information is out there somewhere. So what data scientists will do, they will do data mining. However, before we get to that, we need to figure what kind of algorithms we can use to go and pick those signals that are out there. So something else I'm also realizing is that the computational side is good for signal detection. So I'm seeing here, even in terms of now the social network analysis, you have this network that has something going on. There's some signal coming out from it. You need to figure out which one is noise, which one is information that you really want to lean on. Then computational approaches are helpful in this case for you to go like, okay, we can maybe do A, B, C, and D to get more information within the health science space. I mean, that's an exciting avenue or front to actually look into. One area you've mentioned also, let me just see, just even from the paper. Apart from the side effects, let us see one other area that this can be used. Disease spread. I'm thinking yeah. So also that comes as a place where
and for epidemics, it will be more about surveillance, right? Same data mining, but surveillance through social media, through even at the county level. We have an example where Twitter has been used, even YouTube has been used to sort of, for example, for YouTube, it was more of what are guys searching for when it comes maybe to certain prescription drugs. Like right now, I'm sure if you try to find data on, or rather educative data on Ozempic or a GLP-1 agonist, you can be able to look at YouTube and even Google and kind of see what people are more concerned about. Maybe are they searching information about side effects, about dosages? What is it exactly? Maybe how the mechanism of action, how it works exactly. They just want to understand how did this maybe diabetic drug turn into a drug that can be able to help with obesity rather. So these are some of the platforms where if you get to mine that data, you can be able to, okay, as the Ministry of Health, as board ABCD or organization ABCD, what can we be able to do with this data? Because clearly members are asking, or like citizens are asking about these kind of questions. So, and you as a businessman, you can be able to look at it and be like, okay, this is the major problem our these potential customers are facing. How can we address? It's all data, data.
Mm. So, actually, now coming back to an earlier question and what you've discussed so far, the whole idea here is that computational methods or approaches have these opportunities within the health science space that can be utilized. And it also depends largely on the data, and can all come along on figuring out algorithms for epidemics, algorithms for modeling data, for example, from avenues such as Twitter. Even something I'm seeing here is patient behavior, even, for example, the reporting side effects and all that kind of stuff. So it's actually a whole, how can I say, a whole discipline, which data scientists, I think, in this case, I think data scientists are the one who will exercise this, will have a good time exercising in this space. Because at the end of the day, it's an intersection where you have a Venn diagram of bring this skill of computational approaches and domain, and how does that person execute within that space. Data scientists will have a field day within this kind of environment. Yeah, so that's what I'm saying.
So before we talk about then what has been happening and what has changed maybe since the paper was published, that was like 8 years ago, let's look at, of course, the field has advanced greatly and in large, large steps.
Yeah.
That time, at that time, we were just talking about computational simulations where you have these apps or softwares or websites where you just get in and do a few simulations and, you're okay and stuff. But we have come such a long way where we even, present day, we have agentic AI. They're just doing almost everything for you as a biologist, as a healthcare practitioner. You're talking to large language models. But let's look at that later. Right now, I'd want us to maybe finalize this. That is pre-2080. Finalize that kind of section with the aspect of collaboration. We have talked about the two fields, experts from the two fields now coming together to collaborate in institutions, in research centers and stuff. What advice or recommendations would you have for institutions that are trying to bring the computational bit into health science? For institutions which are trying to be forward-looking and introduce these into their curriculum, and maybe push their students to also be thinking about computational aspects when trying to solve health problems, and not just the social and the pathological and pharmacology and all that side, clinical side. So what advice would you be having for such institutions? How best can they position themselves, be the students, the lecturers, the team leads, what have you?
I think such environments, be it for whatever institution, there's some level of patience that you really need to exercise within that environment, because Clinton over here is a data scientist. He's speaking some other terms, so I need to be patient enough to understand things from his point, and also from Clinton's point of view, he needs to find a way to communicate it in a way that I'll be able to understand. So the communication channels within these spaces need to be something that is really key, because you are bringing in views from different worlds. Then everyone is bringing some sort of value that is important, and there will be that tendency of, this is very important, so this, for example, might take preference. So if you are in that multidisciplinary team, it's really important to appreciate the other person's value, the component they bring, because it would be easy to dismiss and say, this algorithm maybe is not important. What matters here, for example, is the patient, how the patient is feeling. But maybe the algorithm is capturing something that might be very important. So I think those two things are the number one things that come on top of my head. I don't know. Let me see. Something I'm seeing here is that shared vocabulary. So, like having that common point of talking about an event, for example. So, for example, you know, for example, it's something as simple as prevalence. You know, it's something very simple, but or okay. A good one is prevalence is even hard. Something as good as simple as average. When average, by average, do you mean the mean or the median? So for example, so for example, so for example, I'm in a space and I want to communicate that maybe the 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 average, where I'm trying to say, okay, everyone combined, and then you divide, it becomes different to when I'm trying to say the middle value. So to some people, they might be focused on the middle value, and to some people, my average might look different. And this might be important, for example, when you're looking at populations in where the values are skewed. Maybe the distribution is skewed. So it's a whole other conversation, a whole other episode. But something as small as average can either mean mean or median, depending on the
You've even reminded me another one, majority. You know, what do you mean by majority? Right? Yeah. So what is your cutoff point of majority? Anyway, the same now that is when you're applying that vocabulary to a computer science student or a health student or a medic without biostatistics background. Right? So maybe from the average POV of numbers, if you're talking mode, median, average, all that stuff, or mean, I'm sorry, you're talking about maybe a computer science student will understand it. They come from the numbers game. Maybe they understand what you're trying.
So a computer scientist might actually find trouble because statistics might not be their bed and breakfast.
Let me finish. That is exactly where I'm headed. You see, from the numbers game, they understand the dictionary definition of what.
Yeah.
Okay. But from the medical angle, that's a whole different playfield. So that is what we talk about when we talked about context, being contextual. The same way now, when you talk about maybe terms like deployment, terms like I don't know what, to a medic, they won't understand what you're saying. So that's, I guess, reiterates your point. It asks for a lot of patience, and it demands for a lot of communication as well. That whole that whole value or skills that go into collaboration. I'd say, if you allow me, I'd say maybe establishing a shared vision and direction that is grounded in real world challenges or problems really goes a long way, because you are not just coming together for the sake of coming together. You're coming together to solve real world health challenges, and that will keep you grounded. Like, okay, the biggest issue here is this problem. So how do we solve it? From a computational beat and from a medical beat. And by medical, I'm talking also about psychological, social, and all that sort of well-being that goes into the care of a patient. Not just there, oh, we have treated them, they're okay, symptoms are gone, kind of thing.
Yeah, I'm reading something here which is very important. There's this paragraph that says team learning requires commitment, discipline, and a sustained effort through time. Heinemann argues that if social scientists are to do better at model building and quantifying uncertainty, they must broaden their horizons and adapt methods and practices from computer science and computational statistics. I mean, there's a lot to unpack here. Number one, from the commitment, disciplined, and sustained effort through time. That's literally patience being described here. Then Hinman goes to argue that, as you've said, the social scientists, people maybe in life sciences and all kind of stuff, if you want to understand how to build these models, and the bit about models, he goes on to add and quantifying uncertainty, because that's something people leave out when they look into models. People are more focused on the accuracy. They must broaden their horizon and adapt methods and practices. And this is where you mentioned someone from computer science might have a different understanding. However, there is something also called computational statistics that needs to also be. So there are a lot of things that you're keeping track of over here. The social science aspect, the computer science aspect, the computational stats aspect. Yeah.
Okay. So that being said, we can maybe have a brief look at what has changed since the paper was published. We know a lot has changed. We are aware that a lot has changed, and even without mentioning them, we already know the audience knows what has changed since then. But would you maybe care to highlight a few of the outstanding moves or steps that have been taken, or discoveries since then, and where we are presently, where we are looking at next? Can we talk about that? Can we talk about the challenges that we are at? And let's talk in two scales, the global scale and where Kenya is positioned at the moment. And yeah.
Okay.
Maybe the journey of LLMs, maybe computational biology with the release of AlphaFold and then AlphaFold 3. What COVID-19 taught us about computational epidemiology, because I think around that time is when I really got started being interested with being interested with the idea of modeling. And then let's talk about generative AI, or maybe drug discovery, protein design, not AlphaFold again. I'm seeing that. So yeah, and what those whole steps mean for Kenya, and especially for our medical sector and our students, where we are looking at, really.
Okay. So I think where I would like to start off is that number one, most of the time these concepts seem to be so abstract. Like they seem to be concepts that don't even happen at all for within a clinician's life day-to-day life. So that means someone won't come close to a model or won't interact to the outputs that these things give out, as number one. And then number two, it then pushes this thing to the whole spectrum of research. Then you find, okay, this is probably where you'll come into contact with this kind of thinking, this kind of practice. And then number three, we have to look at the capacity of this research. Is it one that allows this kind of models? So you will notice at the top here, they mention that on the other hand, they say this requires some basic familiarity with ML algorithms beyond the linear models that are overwhelmingly dominant in social science today. So you'll find people within a capacity are more accustomed to the linear models, and they will leave it at that because they've proven association. Maybe they've done their chi-squares and all that kind of stuff. So that's the other limitation. So now, number four, coming to the area now you're talking of where this has been used in large scale. now can be, for example, in the COVID spectrum, where we had this whole thing of the mathematics of COVID. I was just looking at the link of a famous, is it a famous really, or something that I really love that talks about the mathematics of COVID-19. And they go about talking about some models that are used to model COVID-19 and all that kind of stuff. So that is now where these things become applicable. Not only, for example, in COVID. Let me think if there's somewhere locally that I have actually seen or interacted with. Maybe I might mention SEMA Africa. I haven't looked deeper into them on how much they've gone, but these are areas that I would assume, or these are institutions that I would assume they would go deeper into using this kind of computational approaches. One other institution I know that loves partnering, like the other day we saw how JQuat was partnering with IHME to sort of do this kind of simulation modeling. And at the heart of this are that computational health science, or computational science and health sciences merging into becoming a unified field or something like that. But now on the innovative forefront, or in the innovative frontiers, I haven't seen something locally, maybe, but obviously there's something. But when you mention something like AlphaFold, the whole idea here is that how are you used to doing research, for example, in biology or in chemistry? When you look at that whole pipeline of where it began, you will find that the initial methods were more so fast identifying that there's something called amino acids in the first place. So first you have to you have to identify that these things exist. Then after that, you look at how they are built, and then after that, you look at how to create, for example, the structure of one amino acid. You have to look at how they were they use sort of dyes techniques back then. So you see, it built up from that molecular kind of approach. Then now, when we had this kind of statistical error, then leading to machine learning, then lead to deep learning, whereby now we have new algorithms that now look at these structures of complex things as proteins, which again, they solve important problems that maybe normal methods cannot really help us. So for example, protein folding in this case is a very interesting or a very hard challenge to solve. However, given enough compute and enough data, we can be able to create algorithms that can be able to solve this. And now this is where things such as AlphaFold come in. And before they went all the way to try and work on protein folding, you see they started with AlphaGo by playing the game Go, you see, which is also a complex game that requires, for example, large amount of compute.
In McHugh, they were trying to solve a computational problem. Let's remember that. They started with trying to solve a computational problem, which ended up solving a biological problem.
Exactly. So that's like literally transferability of such methods to solving now a real world problem. And it goes on and on down to now the part you're making about drug discovery. So in this case, imagine you have this drug that's supposed to bind to this part of the protein. How can you create simulations of how this protein folds when this drug molecule combines over here, compared to looking for the active? There's something you guys in pharmacy call the API. I just know the short form. API. Yes. Imagine how many times you have to reiterate the API of this drug so that you can see if it interacts with this protein. That is expensive. But in this case, if you can do it via computational simulation of how a protein would fold when this drug interacts with this protein, then the discussion changes. So one thing I'm seeing here is that the discussion changes massively when you have these methods come, like when you see them happening in real life, or when you see them happening day to day, the discussion has to change. You can't be thinking of let us create, for example, this public health strategy. The discussion will change from how can you then incorporate that computational approach. So I know we haven't gone like a specific point like this, for example, RCT is doing this, but again, this just shows the broad aspect on where this thing or how it is happening within the current space. I don't know, drug discovery, I haven't seen much, but okay, I haven't, obviously it's happening. Yes, I'm not refuting that, but I haven't taken time to just go over literature and see where it's happening, this here and there, but it's one area that I'm sure it's really happening.
So I just know it's still okay. We're still at the formative stages, teething stages, so to say. We are looking at maybe other processes in the drug discovery phase being sped up, but the challenge still lies with AI capabilities, being able to create a novel product from scratch. That is still a long shot, I guess. And what I can say right now is where I won't say excel, but where there is a lot of promise is in the pharmacokinetic and pharmacodynamic detection of molecules, where you said from the interaction, be it a chemical reaction, be it a structural sort of change, which we used to call them SARs. There's a lot of promise there, where you can be able to predict, okay, maybe this molecule, upon interacting with this receptor based on their molecules, these are the changes that we expect, and therefore maybe this could be the pharmacokinetic or pharmacodynamic property of this molecule. There we are not so badly off. So maybe we can have in future be able to look at the whole pipeline from discovery to post-marketing, where you have an AI product. Yeah. And that being said, we have looked at the global scale, what is happening. We have looked at the advancements of the computational bit, especially through AlphaFold, which have now jumped into the biological bit, where we have great guys doing great things at bioinformatics.
I think something important here might be maybe where is this computational, I know it might be hard or difficult for our audience to really appreciate where this computational thing is coming into play, especially when you say something like AI. Someone is maybe thinking the problem is here, AI is here, give it, and then that's how it happens. But at the heart of things, let's take something like AlphaFold. Let's go to AlphaFold because that you're using. So we are saying here AI is helping in protein folding. So then how does AI do that? So someone realizes that AI or modern day LLMs LLMs run on transformers. So once you understand transformers, that's where you understand the computational bits of how this thing is happening. So for you to go further even is now to understand what kind of data points do these biological entities give out, and how do you make that data point easy for a transformer architecture. So that means that you play around with different kind of architectures to better represent this data, so that the compute with which you are using can be able to do the magic. So again, here there's also the aspect of compute. Now you have to figure out, okay, are we using GPUs? It's a whole other field again to play. So you find that at large scale, there is a lot to think about. Very exciting opportunities. Let's see where it goes. There's a lot to come from the way I'm saying it.
Yeah, for sure. Now, can we talk about Kenya? What is wrong with us? Where are we? What have we done? What's the market looking like? What's the industry looking like? Where are we failing? Right? And what are some of the suggestions or recommendations that we have, guys doing this.
Okay. So for Kenya, maybe let me cite something positive. Let me try to be positive thinking. I'd say, I mean, we have really good professions out there. People who are going to Google research, people who are in these top universities. We have some good PhDs who are actually looking into this. So actively, people, I'd say at a personal level, people are really doing this to some extent. People are really practicing this. People are really playing around with these models, are really working on them. However, institutionally, that's where the challenge sort of comes in. And this is largely because of, let me say, funding also. So the funding may not be there. And this funding will actually be important to keep now the talent in-house and make this talent, for example, do A, B, C, or D. So no funding, the talent won't really stay here, and it goes on and on. Now, where has it actually been used? Honestly, let me think. KEMRI.
KEMRI, they have a whole genome bank. They're trying to do stuff with genetics, but we don't know the maybe outcome, the definite outcome, in terms of real world solutions that have been launched into the market. They did advertise for a PhD position in maternal genome, something. I'm forgetting, but I hope something comes out of that. I hope we get to have something at the end of the day that is applicable to our situation, third world country or a lower.
If someone asked you, pick one area that maybe you'd want it to be implemented, where would just one area in Kenya where you think this computational health science practice needs to be implemented?
I don't think I understand your question very well, because I'm like, for the computational bit, we have to get a lot of things right. We have to get the infrastructure right.
Yeah. So yes. So in this case,
get the talent right. We are not even, you see,
it's a hypothetical question in the sense that, like, just imagine, like, you have all the money in the world, and you just pick one area where you think you'd want computational sciences to like from tomorrow.
Start with the start with the institution.
Okay.
Yes.
Okay. That makes sense.
Do you know why I'd start with the institutions? Because out here, of course, we have a lot of systemic problems. We have the problem of data literacy. By data literacy, I mean our data practices, from collection to storage to analysis to making now data-informed decisions. There's a lot of guesswork that is happening currently. I don't say this with with any ill feelings, but there's a lot of guesswork that is happening, and we are just lacking a lot in terms of knowledge on how to maybe make data-informed decisions. But so to change that, you'd start them early, start them young. That's what they say. You go to institutions, involve or integrate these methods or ways of doing things into the curriculum, be it a higher learning institution, because by the time maybe you're coming as a professional maybe, the best you will get is a CME. And from there, maybe if you really are interested, is when maybe you go for your master's, your PhD and all that, and even go ahead and publish and do a whole sort of research on the same. But how many medics will be interested in that if they do not meet it earlier in life, if they are not aware of the opportunities that they face, if the problems that we have cannot be addressed by computational methods if we lack infrastructure and all that stuff. So I'll integrate it in the institutions through the curriculum, if you ask me, because I wanted us to touch on, as we finish up, the AI bill that has been introduced into Parliament. On the regulation side, I'd say we are not doing so badly, but we are regulating a market that has not even caught up yet. There's an interesting post you shared early this week about open evidence.
Oh, open evidence.
Yeah, open evidence has geo-blocked the UK and Europe because of their stringent AI rules. And now, as we speak, there's a bill that I've come across that is in the Senate that addresses AI. And there's a very familiar language I've seen, and I've tried to compare it to the EU regulations about high-risk AI usage or AI devices and stuff like that. Now, we ourselves as the medics, if we are not good or if we do not even understand computational health science, how can we be able to tell this regulation is good for us and this one is bad for us? Right? So we need to integrate these into the curriculum. We need to understand, because we keep saying we're trying to teach students to meet the ever evolving market needs. Right now, the market needs people who are good at computational methods, who are good at computational thinking and approaches towards solving health problems. That is the kind of the talent that the market needs. So how do we place ourselves there? How do we get there as a profession and as a country?
Work needs to be done. As you said, institutions. Hopefully, institutions hear this meeting call and they answer. The answer. But yeah, there's a lot that needs to be done. Even in terms of even after just thinking about institutions, the whole idea is, okay, then where do these people practice, or how do we change our practice? So it becomes a whole mind shift within the scientific community, because if these things are regulated upfront, then it might even discourage institutions to even invest in the first place towards such endeavors. So it's something really tricky to see how we proceed with it. I mean, it's something really interesting, really tricky at the same time. There's a lot of things, as I like to say, simultaneous questions, learning the left, right, and center to try and solve. For example, here I'm reading the systems part. They are saying, challenge the system, which is traditionally not supportive of interdisciplinary work. Create courses, degrees, and even tenure career that are supportive. Then it goes to say win-win. Create a plan that supports the unique disciplinary scholarship expectations, will help strengthen a long-term interdisciplinary framework for faculty and students alike. That's what I was saying. Like, even beyond giving the institutions this capability, how then can this go on and forth? There's a lot of work.
Yeah, there's work to be done. There's definitely work to be done. But I'd say let's start with the curriculum and let's keep talking about these issues. Otherwise, that's all from me today. I really enjoyed this session. I hope we can keep talking about this session in our social media pages. At Afia Data KE, I guess, on Instagram, Afia Data on LinkedIn, and what else?
Here on YouTube. Please leave a like.
Definitely.
Subscribe, as they say, and share as well, as we keep this conversation going in the intersection of medicine and data. Until next time, it's been David and I here, and daktari kutoka Pwani si Kenya. Huko kuna joto. I am the cold here, hey. It's even a miracle I'm just wearing one sweater. But anyway, until next time, dog.